I'm Chris Gibbs. I'm a hand and upper extremity specialist at OrthoUnited. I'm originally from the Akron area. I went to medical school at Mayo Clinic in Rochester, Minnesota, and then I did my residency in orthopedics with a clinician scientist track at the University of Pittsburgh. And then I did my hand and upper extremity fellowship, specializing from the shoulder to fingertip at Wake Forest University in Winston-Salem. I chose orthopedics because I really liked the aspect of being able to basically fix a problem. I liked orthopedics over a lot of other specialties because of their hands-on nature and the more mechanical aspect of being able to fix things like tendons, nerves. I did my fellowship at Wake Forest University. The reason being, it was a hand fellowship and we did very intricate microvascular training, but it really was a full upper extremity fellowship. So it was truly the breadth of the pathology that encompasses much of the upper extremity, which really drew me to that fellowship. I feel very blessed to be able to practice in my hometown. I think very few people really get that opportunity. This is a great place to raise a family. I have 6 children, and being able to have a place where they're able to have good schools and have a great community to grow up in was definitely a big draw. I'm really excited to be able to kind of serve the community with being able to train at some pretty world-class institutions, bringing back care to Stark County that's world-class is really a pretty cool opportunity. One other thing I really wanted for my career and practice was to be able to really have a closer relationship to patients. You don't just know them for one surgery, but you know them within the community. That was really important to me. I wanted to be able to have patients that I got to know over the course of their lives, of course my career, and kind of be able to care for them longitudinally and not just kind of a one and done kind of interaction. It's very rewarding to see patients out at the grocery stores or the gyms or the schools that you've helped, and being able to kind of know people that way is really special. I was drawn to OrthoUnited. First and foremost was really the partners. I felt that the mission of the group is really putting the patients and their needs first. OrthoUnited has a lot of resources that really let patients have very quick access to quality orthopedic care. You basically can get hurt and then walk into our urgent care any day of the week and be plugged into an orthopedic specialist almost instantly. One of the things that is very exciting for patients at OrthoUnited is the ability to schedule online with just a few clicks of buttons on their phone or computer. Many times patients are able to schedule with an orthopedic specialist within the same day. One of the big benefits of OrthoUnited is being able to offer a full suite of orthopedic services in one location. If I'm seeing someone that has a problem with their arm and they also have a problem with their spine or something, which is very common, there's a lot of overlap. If I have a question or anything, I'll run over the little office space and get one of my spine partners to take a look at it. Some of my partners have over 30 years of experience at OrthoUnited providing orthopedic care in Stark County and Summit County. On a daily basis, we have patients that we share, that we review images or plans with each other in an effort to really provide the best care possible. There is a wide variety of physicians in the office pretty much at all times that cover the full range of orthopedics. So being able to really take everyone's expertise to make the best plan of care for a patient is something I think that really sets OrthoUnited apart. What I would say to people out there living in pain in their hands and wrists and arms is really, it's very important to get checked out for that. There are many conditions, for instance, in the hand and wrist that an injection is actually curative, meaning it can make the problem go away in the majority of patients. And then patients are pleasantly surprised afterward of how easy it was.